Hello, good morning. I'm Dr. Aina, and today I'm going to do subjective examinations on you. Firstly, may I know your name?
Samantha,
What's your age?
21,
What's your weight?
50.
Okay, I will ask a few questions. First, do you have pain?
Yes, I have pain in my abdominal area.
Okay, and do you vomit?
Yes,
Okay, how many times do you vomit per day?
twice a day.
And how long the vomit happen?
2 to 3 days.
Okay. Next, when was the last time you urinate?
I have not urinated for at least 12 hours.
Do you have appetite lately?
No, I don't.
So did you drink or eat anything?
Just a little bit.
Okay. Do you have fever?
Yes, I have.
Okay, thank you. Okay, so to conclude, it looks like you are having a fluid deficit due to the vomiting with stomach content, and you also have no appetite and high fever. So there is no disease that can be detected yet. Okay, next I'm going to do objective examination, which is the first one is general inspection. Okay, so from what I observed from this patient, she is well nourished and she is in satisfactory condition. And then for shoe, she looks like her age, and she is also responding very well, and she is aware, so she is conscious. And next is skin. As I can see here, there is no signs of paleness on her skin, and the humidity is normal. And for nails, there is no signs of brittleness, and the elasticity of the skin is also normal. Okay, next I'm going to do respiratory inspection. So first, the patient needs to take off her clothes, and the patient also needs to stand up during the inspection. So Miss, can you stand up? Okay, so first I'm going to check the symmetrical of the chest. So from what I observed, the patient is having a symmetrical chest. Okay, next is palpation. Okay, so Miss. Okay, so from the palpation, I can conclude that the rigidity of the patient chest is also normal. And then for percussion, okay, from the percussion, her breathing is also normal. And then next is auscultation. Okay, so next I'm going to do auscultation. Okay, so from the auscultation, I can conclude that the patient is having tachypnea, and her breathing is around 26 per minute, and the vocal primitive is also normal. Okay, so next I'm going to do the cardiovascular inspection of the patient. So firstly, I'm going to measure her blood pressure. Okay. So from what I can conclude is her blood pressure is around 120 over 95, which is normal. And then for the pulse rate, her pulse rate is slightly higher, and I can conclude that it's around 24 to 26 per minute. Okay, next I'm going to do a GIT inspection on the patient. So first, I need to ask the patient to cough. So, Miss, can you please cough? Do you feel any pain?
Yes.
Okay, right now I'm going to palpate the patient. So, Miss, can you please tell me if you have any pain while I palpate? Okay, so do you feel any pain here?
No.
Over here?
Yes.
Do you feel any pain?
No.
Do you feel any pain?
Yes.
Feel any pain here?
Yes.
Do you feel pain?
No. Yes. No.
Okay, so to conclude, this patient is having pain in all the abdominal areas. Okay, so next is the genitourinary system inspection. So from what I can conclude is the urine output of the patient decreased and the urine color of the patient is dark. So this patient is having dehydration.
The next step is the post-subjective and objective examination after taking of vital signs of the patient. So this is where we are introducing infusion therapy before surgery. Okay, just to double check, what is your name, miss?
Samantha.
Alright, okay, so you have been informed that you will be undergoing surgery for peritonitis, yes?
Yes.
Okay, so we'll be admitting you to the surgical department as of today, and we will be transferring you to a ward, and then we will start your treatment from there. So before that, I need to explain to you that you have been informed that you have secondary peritonitis, yes? Okay, so this would lead to dehydration. So you are technically suffering from tachypnea. Your breathing is very fast, right? Yes?
Yes.
And then tachycardia, which means that your heart rate is also feeling a bit fast. Your skin is also dry, may I see? And then you have hypotension. We measured your blood pressure and it was low. Mentioned oliguria, high fever, and you also suffer from vomiting.
Yes.
Okay, we'll be proceeding for your treatment immediately. So as we admit the patient into the ward, the patient must be in a fallless position. Miss, can you please sit up for a while? So we need to maintain into a fallless position. So this actually eases your pain and helps with your lung ventilation. And the patient is also be set under NPO, which means nothing pros, so that the patient cannot eat anything or drink anything. Now we'll start with intravenous catheterization. So a peripheral intravenous catheter is set up to administer fluids to patient, and this is to rehydrate them as they show symptoms of dehydration. So we assume that we are cathetering the patient. Then you need to adjust the speed of the fluid getting into the patient. So does that hurt?
No.
Okay, so I'm going to leave you for about an hour and I'll check up with you in intervals of 15 minutes. So if anything hurts, please tell me. Antibiotics is administered to patient to prevent local and hematogenous spread of infection, and this is also reducing late complications. So usually antibiotics such as ciprofloxacin and metronidazole are given through IV. Does that hurt?
No.
Alright. And then sometimes antiemetic drugs are also administered and given to relieve nausea and vomiting due to dehydration. So a nasogastric tube is done on the patient to drain their gastric contents, decompress stomach, obtain specimen of gastric contents, and to introduce a passage into the GIT. So we assume that this is a tube. Present a nasogastric tube into the patient. So we will usually stick the tube here and then it will enter the patient's nasal cavity. Foley's catheter is inserted into a patient to measure the urine output and determine the level of dehydration of the patient.
Due to dehydration, extra 5% water and Latin Ranges solution are used. And at 11 a.m., doctor starts by giving initial fluids of sodium-free water, which is dextrose 5% solution to patient. This table shows the composition of solution, which is administered due to patient having volume depletion and occurs when loss of extracellular fluid volume, and other reasons of administration is due to lab results that shows a high level of hematocrit. This indicates that the patient is dehydrated. So this solution is again to supply adequate initial volume to the patient. The lab results also shows that the patient is also experiencing hyponatremia, which indicates of sodium serum in a high level. This occurs due to water shifting from intracellular fluid to the extracellular fluid, which again is the mechanism of dehydration that occurs in the body. So dextrose 5% solution is given for this occurrence, and the sodium value is monitored to ensure any changes to be lower than 150 milliequivalents per liter. Crystalline solution is also administered to the patient, which must be the same value as dextrose 5% solution, which is 1,500 milliliters. Crystalline solution is commonly used for NPO patient and also to replace intestinal juice which is lost during vomiting. All solution administration is to recover the amount of fluid lost during dehydration and S preparation before and during surgery. After an hour, both solution is administered at 1000 milliliters respectively, and the reason of reducing this volume is due to patient which gave the response to the fluid treatment. This indicates that the sodium level decreases from 150 milliequivalents per liter to 140 milliequivalents per liter, and this also shows that the sodium level has returned to normal state. After making sure that the electrolyte levels and also the water levels of the patient has returned to normal or to a stable level, it is important for the doctors to make sure that the vital signs are on check before heading to surgery. And before moving on to the vital signs examination, it is very important for the medical personnel or doctors to wear personal protective equipment or to wear sterilized gloves and also sterilized mask. For vital signs examination, firstly we have to check the patient's consciousness by asking simple questions such as his name, age, and his whereabouts. And vital signs consist of three main examinations. Firstly would be the body temperature, secondly would be the pulse rate and also the heart rate of the patient or respiratory rate, and lastly would be the blood pressure of the patient. The results of this examination will be updated in a table for future references after post-surgery. So during intraoperative, as a medical personnel or as a surgeon or the doctor in charge, we have to explain to the patient on when does the surgery starts and how long does it take for the surgery. And it is also important for us to explain in simple terms of the procedure during the surgery and make sure that the patient understand on what is going to happen during the surgery. And lastly, it is very important for the doctor in charge or medical personnel to ensure the patient that the surgery will go well, and we will try our best on conducting the surgery. The patient was given infusion therapy of 3000 milliliters between 1 till 3 p.m. to stabilize condition. And the antibiotics given is metronidazole and also ciprofloxacin. And after surgery, the patient is transferred to the ICU.
Okay, today we would like to have a first post-operative. So, my duty is to take the general condition of the patient, such as pulse rate, respiratory temperature, blood pressure, and urinary drainage, and also consciousness. So, patient, hello, good evening. My name is Dr. Najah. I would like to do some general inspection before our first post-operative. So, is it correct? Your name is Alice Swasya? Alice Swasya?
Yeah.
Your age is 22.
Yeah.
Okay. I have some questions and we need to answer yes or no. Okay. First is, did you feeling pain?
Yes.
At where? Which position? Okay. Did you have any nausea?
No.
Okay. It's okay. For now, I would like to observe your pulse rate and respiratory rate. Is it okay?
Yeah.
So first of all, check the pulse rate of the patient. One. And then check the respiratory rate of the patient. Breathe in, breathe out. Okay, breathe in again and breathe out. Okay. After that, we can perform blood pressure, and we also need to send this patient to the lab diagnosis for urine specimen. So for now, we need to palpate the patient so we can check any other complication before the surgery. So we need to check of the patient before the surgery. So the patient, do you have any scars or any previous no? Okay. Did you feel any pain on your abdomen? Okay. Okay, pizza.
Then we save in the data. The time will be at 4. So, according to the observation, the vital sign, pulse is 90, respiration is 18. There is no mechanic ventilation. Pressure is 130 per 80, consciousness is 9, temperature would be 37, skin is pale. For laboratory diagnosis of urine sputum, the urine would be yellowish, there is no blood present, expected is 70 until 80 milliliter per hour. After the first cycle, repeat the re-examination for 30 minutes, 1 hour, 2 hour, 4 hour, 8 hours. So for example, after 30 minutes at 4:45, the pulse of the patient is 90, the respiration would be 18, the blood pressure would be 130 per 82, consciousness is 14, temperature is normal, skin is moist. Then we can observe the other of re-examination and need to be key in the data so that we can keep up the patient's observation. Then we can keep up the patient condition. That's all.